Hello, and welcome to Living Well. Live your best life with osteoarthritis. This is a hip and knee osteoarthritis education session. My name is Tara, and I will be the physio leading the session. First of all, we would like to do a land acknowledgement. We recognize and acknowledge that we are collectively gathered on the traditional, ancestral, and unceded territories of the 7 Interior Region First Nations. This region is also home to 15 chartered Métis communities. It is with humility that we continue to strengthen our relationships with First Nation, Métis, and Inuit peoples across the interior. What will we be going over during the session? We will be talking about the total joint pre-op pathway. What is osteoarthritis? Physical activity, weight management, pain management, goal setting, and home safety equipment. So let's get right to it and get to the important stuff that I know you're eager to learn about, the total joint pathway, what you need to know. First of all, your surgeon wants you to know that you must be an active participant in your preparation and recovery for success. The more you put in, the more you get out. You are the captain of the team, and we are all here to give you the tools you need to reach optimal success. But definitely, the more you put in, the more you get out. Surgeons also want you to have realistic expectations. The goal of a knee or hip replacement is pain reduction. It is not to walk the 10K faster or go for a bike ride that you haven't done in the past. Yes, we want you to be physically more able-bodied after, but the number one goal is pain reduction. So if you don't have pain influencing your quality of life, you need to ask yourself, is now the right time to have your joint replacement? There is an online waitlist you can look at. If you Google BC Surgeon Waitlist online, this website will come up. Your name will not be on the website, but you will be able to search by your surgeon to see what the approximate wait time is for your surgeon. We want you to know that your waitlist starts once we receive your booking slip. What do I mean by that? Well, what I mean is it doesn't start when you had your x-ray or when you saw your family doctor. It actually didn't even start when you saw the surgeon. Your wait list starts when your surgeon sends in the referral indicating that you are a surgical candidate and the OR booking gets that form, because you are waiting for two magical things to happen: the surgeon to have time and the operating room to have space and capacity. When those two things align, that's when you get your surgery. So once you've seen your surgery and said yes, you want to be on the surgical pathway, your wait list starts very shortly after that, a few days usually. The surgical optimization clinic is when you connect with our nurses. This is mandatory. The reason this is mandatory is because the nurses are making sure that you are medically stable to have your surgery. Total knee and total hip replacement are deemed an elective surgery. Yes, you did not elect to have osteoarthritis, so this can be a little bit of a triggering statement at times. But what we are saying is you are electing to have surgery. You are going to know the date of your surgery. It's not like you just fall on your driveway on ice and break your hip and we're trying to pull the pieces together and it's more of a crisis. For a total hip or total knee replacement, you have time to plan and prepare to get prepared. This means that we're able to have a good discharge plan. So the average length of stay for a total hip replacement is 0. You usually go home the same day you have surgery. Isn't that amazing? For a total knee replacement, the average length of stay is 1 day in the hospital. It is absolutely essential that you have a buddy post-op. So your buddy can be friends, family, or it could be somebody that you hire privately. But it is essential to have that buddy so that you have somebody there for the first 72 hours after your surgery to help pick you up from the hospital, to help you with meals and anything you may need in your home to allow you that first couple of days to really recover. There are no publicly refunded rehab beds. So if you don't have a buddy, unfortunately, that means we might have to delay your surgery because we absolutely don't have anywhere else for you to go if you are unable to go home. So we need that buddy. Now, if you don't have friends or family, that's okay, because that can be a bit of a commitment. But there are some private home care support services that you can access. Look on these links, go to Nexus BC, or look in your local town to see if there are any private services that could help you. It doesn't even need to be somebody in the healthcare system. It just needs to be someone who is able to help you for that first 72 hours. So now let's talk about the surgery. The total hip replacement. The hip joint is a ball and socket joint. You can see how it's a ball from that femur or thigh bone going into the pelvis, which is the socket. For the total hip replacement, the ball of your hip bone, the femur, will be removed, and you will get a femoral stem, or a prosthesis we call it, inserted into the femur bone. Then you will get, it's called the acetabular component, but that's a cup that's put into the pelvis. With that cup, you get a plastic liner, and that's acting almost like fake cartilage. That together, which is the stem, the liner, and the cup, is what makes your hip replacement. What is amazing is that most hip replacements being done now are minimally invasive. What do we mean by that? We mean compared to the traditional hip replacement, these new procedures, which are not necessarily new anymore, but they are amazing, have a very small, much smaller incision, and they leave those major stability muscles of the hip, the glute med and the piriformis, fully intact. So for traditional hip surgery, those muscles were detached and reattached. But with our minimally invasive approaches, such as the direct superior approach, these muscles are left intact, so your hip is quite stable after. There are some small little stability muscles that are detached and reattached, but they are quite small and usually almost atrophied by the time you have your surgery. Total hip replacement surgery is an extremely successful surgery. For the total knee replacement surgery, the incision is over the front of your knee, a little bit towards the inside, but over the front of your knee. They will dislocate your kneecap towards the outside to get some access to the knee joint. Because they dislocate the kneecap to the outside, we really want to make sure that inside quad muscle is nice and strong, because that muscle can get stretched a bit and weakened with our osteoarthritis. So with the total knee replacement surgery, there is the prosthesis on the top bone and the bottom bone, on the femur and on the tibia. The tibia is your weight-bearing bone in your lower leg. Then, from the majority of total knee replacements, the ACL and PCL ligaments are removed. And in place of those ligaments, you will have a plastic spacer that has a post. So in this picture, you can see the post in the middle. That post acts like your stability ligaments. Your surgeon is looking at the size of your bones and the length and strength of your ligaments in order to choose the best size for plastic spacer and for the components. It's not a one size fits all. Your surgeon is picking the right components for you to balance stability with mobility. Now, if you look at this picture, all you see is bone. So the surgeon is sawing off the ends of both of those bones in order to put on the tibial and femoral components. But what you don't see on this picture are any muscles. And that's because the surgeon is doing their job and they are doing it fantastic. But they're fixing the joint. They're fixing the areas that the osteoarthritis has affected. They are not injecting something magical into your muscles to make them longer or stronger. So when it comes to the most successful joint replacement, it's a balance of the surgeon fixing the joint, but you yourself being that captain of the team and helping to get your muscles and all of your soft tissue to the best length and strength possible for the most successful surgery. So where do we start? Well, if you see surgery is the top of the pyramid, it's the final step if the bottom of the pyramid is unable to be managed. Having said that, the bigger of a foundation on the bottom, the more successful and smoother your surgery goes on the top. So what's on the bottom of this pyramid? Well, we have education, exercise, nutrition, joint protection, and self-management. Well, you're doing the education piece right now, gold star for you. We're going to learn some exercises during this session and some facts for diet, ways to protect our joint and self-manage our osteoarthritis. If you have the financial means, you can always seek private physio or private occupational therapy to help with any other joints or to help with more personalized exercise plans. And pain medication is also part of that pyramid because we need to have our pain managed so that we can best exercise and build that bottom of the pyramid. That's where surgery is the top. So just because you have hip or knee pain does not mean that surgery is inevitable. But the stronger the foundation on the bottom, either you can prevent surgery or you can optimize your surgery. So what is osteoarthritis? Well, our bones, the majority of our joints in our body are called synovial joints. What is a synovial joint? A synovial joint is a joint where the ends of the bones come together, but the ends are covered with cartilage. The cartilage helps with shock absorption and lubrication, okay? So joint gliding. So with osteoarthritis, there's an imbalance of cartilage regeneration and degeneration. So unfortunately, due to this imbalance, cartilage is decreased. So I don't want to say worn away because it is not a wear and tear disease. It's that imbalance. You might say, well, why does this imbalance happen? Well, we're going to go over risk factors that can lead to an increased breakdown of cartilage. We're also going to talk about things that can really help to build up your cartilage in the next couple slides. It's the most common type of osteoarthritis. It's not one of the autoimmune arthritic diseases such as rheumatoid arthritis. It is more of that imbalance. It's where cartilage, which acts as a shock absorber, wears away. This can cause joint pain, stiffness, and swelling. And it typically affects our weight-bearing joints, such as our hips and our knees. And with these weight-bearing joints, every time you stand up, you're on those joints. So it's hard to give them a rest, but it's also, if you have that imbalance or malalignment or poor loading patterns, it's hard to get off of that. So now let's talk about how we can really build up cartilage and nourish cartilage, but also how cartilage may be broken down. This is the physical vicious cycle of arthritis. So something happens. So we're going to look at the 1 o'clock time slot of this slide. Something happens to cause cartilage damage. Maybe you have a repetitive motion you need to do for work, and in that motion, it's not loading the joint optimally. Maybe you're quite overweight and that's leading to an increased load through that joint. Maybe you've had an injury that's caused damage to the cartilage, or maybe that injury was not rehabbed ideally, so you never had the proper muscle patterning in that joint after. So something has happened to cause some cartilage damage. So what happens when there's damage? Well, your body sends in the fighter cells, the first stage of healing. That is the inflammatory stage. Your body is trying to heal the area by having inflammation. And what comes with inflammation? Some pain. But what do the majority of us do when we feel pain or we feel our joint might be swollen or sore? We go into a relieving posture. Think into your mind. Think in your mind, what relieving posture may you go into when your knee was sore or your hip was sore? Sitting, laying, resting. Did you go out and do that walk you were thinking about? This is at the beginning especially. Typically, when we feel that inflammation and pain, we reduce our activity. What does this mean? It means that now we're getting a lack of exercise because we are being more sedentary. Now, this is a twofold problem. One, it's a problem because if we don't exercise, our muscles are going to weaken. And remember, cartilage helps to absorb shock in the joint. But what else can help to absorb shock in the joint? Muscles. Working eccentrically, they can help to absorb shock also. So if we're not exercising and our muscles are getting weaker, we are now having less muscular intervention or involvement to absorb that shock, resulting in more loading on the cartilage. What about poor cartilage nutrition? Well, this brings us to the whole concept of motion is lotion. So our body gets oxygen by our heart pumping and moving blood around our body. But our joints don't have a pump to get nourishment. In fact, it's movement that helps get nourishment to the cartilage in our joints. So around our joint, think about it as being like a saran wrap. That is our capsule. Our capsule secretes something called synovial fluid. This synovial fluid nourishes the cartilage, but the only way for cartilage to get this synovial fluid is through movement. So if you're feeling pain and sitting or laying more and now not moving that joint, you're now no longer getting the optimal synovial fluid to nourish that cartilage. So what this means is we're now having poor cartilage nutrition. Thinking about that scale of regeneration versus breakdown and degeneration, we're tipping that scale to be more breakdown now. What does this mean? More cartilage wear, and the cycle continues. So at the end of this video, if you remember nothing but 3 words, this video will be a success. And what are those 3 words? Motion is lotion. We need to move to help nourish our joints. We need to keep moving. Motion is lotion. Chant that to yourself over a couple times now, just to really get it to sink in. Motion is lotion. Powerful words, those 3 little words. Let's take a look at some x-rays. This is a non-arthritic hip x-ray. I don't like calling it normal. I like calling it non-arthritic. So what you can see is there is a very lovely joint space, and you can't see cartilage on an x-ray, but it's implied by having that lovely joint space. Now here is an arthritic hip joint. You can see how there's a reduced joint space. Because the cartilage has been broken down and is no longer there in the amount it's supposed to be, there is that reduced joint space. Here is a non-arthritic knee. Look at that beautiful symmetrical joint space. The outside of the knee is to your left because the fibula is your outer bone of your lower leg. You can see the patella in this x-ray, which is your kneecap, which is a floating bone. And look at that lovely joint space. Now let's look at an arthritic knee joint. This knee joint has a reduced joint space on the medial aspect especially. It is more common to have medial compartment osteoarthritis because the inside part of our knee has a larger surface area. And because of something called the screw home mechanism of our knee, that's where you're able to lock your knees, you get more surface area, more joint contact on that inside part of the joint. You still get arthritis on the lateral or outside part of the joint, but just if you're wondering why some people get it more on the inside versus the outside, well, the screw home mechanism and the larger surface area are 2 reasons. You can also get something called bone spurs. So what is a bone spur? Bone spurs are your body's attempt to help, but they don't do a very good job. Sometimes our best intentions don't work out. So what happens? Well, your joint needs space, and your brain says, wow, I need some space. I need space for the tissue. I need space to reduce the pain. So it's just like if you're a kid and you're doing the monkey bars over and over, and you get calluses on your hands to build up that resilience. Your body says, I better build some bone. So they build these bone spurs to thinking that they're going to help. But in reality, bone spurs cause problems. They can cause tendons or ligaments to rub against them, causing pain. They can cause joints to lock up or have a reduced motion. If you do have bone spurs in your knee at this time and you're going for a knee replacement, the surgeon will remove those during the surgery. So what are some symptoms of osteoarthritis? Well, the first one is pain. Usually it's pain with activity to begin, and then it turns into pain with activity, but then also throughout the day, and then pain all day and all night. You always have an ache or an awareness in that joint. Stiffness, especially stiffness after periods of inactivity, sleeping or sitting. Think about how if you're not moving, you're not getting that motion is lotion. Well, with osteoarthritis, that really becomes larger, that stiffness, a larger issue with that stiffness. So if you have been sitting or laying for a while, what you need to do is warm up the joint before you stand up and move. So bend the knee a couple times. Lift the leg up and down a couple times before you start walking or before you get up. Loosen up the joint. You can get a swollen joint. That is, you might always be in that stage 1 of healing, that inflammatory stage where your body's trying to heal. Your knee could be unstable. So let's go back to this picture. So think about the x-ray on the left, the normal x-ray, and there's ligaments on the outside of the knee, the LCL and the MCL. So LCL is on the outside, lateral, and MCL, medial, is on the inside. So now with that nice joint space. Now look at the x-ray on the right. If the ligaments are still the same length, let's say 1 inch, and the joint space is now reduced, what happens to those ligaments? Well, they become a little bit lax, right? They don't adjust at the same ratio as that loss of joint space. So if you have lax ligaments, then some people with knee osteoarthritis can sometimes feel like their knee is going to give out. What can we do to help with this? Dun, da, 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 muscles, right? By having strength and stability and alignment in our muscles, that will help us with stability. Reduced motion. So an arthritic joint wants to move into what's called the open capsular position. What is this? Open capsular position is the position of most space. It's where your joint is trying to get space. So for the hip joint, that's 30 degrees of flexion, so lifting the leg in the front, 30 degrees of abduction, that's your leg to the side, with some external rotation. So if you lift your leg like that, a little bit in front, a little bit to the side, and then turn your leg outward, that's the position your leg wants to be in. Now lift your leg like that, but then put it on the ground and see what happens to your trunk and your knee. So if your hip's in an open capsular position, usually you end up leaning over that leg a little bit, okay? Usually you end up with some knee flexion, or your knee being a bit bent also to compensate. So these positions, these open capsular positions, reduce motion because they result in tightness and weakness. So if your hip wants to be in that position, it doesn't want to go behind you into extension. So people with severe advanced osteoarthritis of the hip usually can't pull their hip behind them into extension. Usually they end up extending their back or compensating and doing alternate patterns instead. What about the knee? Well, for the knee open capsular position, it's around 25 to 30 degrees of knee flexion. So a little bit of knee flexion, bent. But when your knee bends a little bit, what happens to your hip and your trunk? You end up with your hip being a bit flexed or bent, and you end up with your trunk being forward. So once again, we have an imbalance of weakness and tightness. Fatigue. Fatigue is a symptom of osteoarthritis. It's actually more related to having chronic pain. So the fatigue related to osteoarthritis is not fatigue you can sleep away. Oh, I'm tired, I'm going to have a nap. As much as it is lovely to have a nap sometimes, we don't want you to do that for your symptoms of OA, because what happens is it's the fatigue related to chronic pain and always having a ramped up nervous system. So what would be better? It would be better to choose something that's energy giving, we call it, something that excites you, something that brings you joy to get out of that fatigue cycle. What is a modifiable risk factor? Well, a modifiable risk factor is something we can do to change, something we can have influence in. So one, physical inactivity. We just said that if you don't move, you're going to get weakness in those muscles. So then you're going to have more shock and loading through the cartilage. If you don't move, you're not going to get that motion is lotion, which is that synovial fluid to the joint, right? So we need to move. Physical inactivity is something we can change. If you are overweight, 1 pound of weight is 4 to 6 pounds of load through the knee or the hip joint. So knowing that a little bit of change, if you are overweight, can go a big distance. Muscle weakness, we've already discussed this in relation to the shock absorption and cartilage loading. And then joint overload or joint injury. If you're always doing the same motion over and over and over again, whether it's due to a sport or an occupation or just how you have a pattern of moving, and that's causing undue stress in that joint and more loading, maybe we need to be thinking about how we're doing things and tweaking our movement patterns. Or if you have a joint injury, but it wasn't rehabbed ideally, that also can lead to osteoarthritis. Physical activity. Don't these people look like they're having a good time being out there enjoying the sunshine or the fresh air, or in the pool, just taking a load off those joints, right? But while they're moving. So I'd like you to take a moment and think about physical activity and what are some of the benefits of physical activity. Why should we move? Is it just isolated to the hip or the knee joint, the benefits, or are the benefits bigger? So yes, there's benefits at a local level. So thinking of the hip or the knee joint, such as if you exercise, you're going to increase your strength, you're going to get that motion is lotion. But what are some other benefits of physical activity? Because we all know that we should move. But really, you need to find your own reason to buying in to the concept that you need to move, that physical activity is important, that you want to add it to your day, especially if you're not doing it currently. So what are some other benefits of physical activity? Well, one is improved mental health. In fact, regular physical activity is as effective at treating or preventing mild depression. Who knew? Isn't that amazing? It makes you feel good and it can help your mental health. Physical activity has been shown to help reduce the risk of certain cancers, such as breast or colon cancer, reduce the risk of things like diabetes or metabolic disorders, also cardiovascular disease, so heart disease. Think that your heart's a muscle. We need to use it to keep it nice and strong. So physical activity really helps us when it comes to reducing our risk of chronic diseases also. It also really helps our brain health. So think about your reason. Do you have a family history of heart disease? So you really want to keep your risk as low as possible? Are you someone who has been struggling with their mental health? Are you someone who has been struggling with weight, right? Physical activity, pull your reason out and then keep that reason close to your heart moving forward to keep yourself motivated. So the Canadian Physical Activity Guidelines are 150 minutes per week. So that's 22 minutes a day, every day, or 30 minutes, 5 days a week. Now you might say, whoa, 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 pump the brakes, 30 minutes? There's no way I can do that. I am in a lot of pain. So then we take a step back and we say, it doesn't need to be all at once. It can be little bouts of activity that you accumulate throughout the day. And it's a variety of aerobic, strengthening, and stretching. Why do we need to strengthen? Well, you need to have good, strong leg muscles to reduce that joint stress as much as possible. You want to have strong arm and core muscles because that will help you mobilize after the surgery and just help you control your movement after the surgery as best as possible. Stretching. Well, it's a concept of walls of the house. So if you think about a house and think about a joint being that house, if one side is really tight and one side is weak, we can't just strengthen one side, because we're going to have that really tight cement wall that we're strengthening against. You need to work on all sides. So you need to stretch one side usually when you're strengthening the other. And this is to have equal walls of the house to keep that roof nice and level, okay? So we need to stretch. For the hip joint, this usually means we need to stretch the structures on the anterior or the front side of the hip, such as the hip flexors and the rotator muscles, those external rotators. For the knee, usually we need to stretch out the hamstring muscles. What do we need to strengthen? Well, we need to strengthen the glutes for the hip and the quads and the glutes for the knee. But right now we're talking about stretching. We're going to go into exercises in a little bit here. So we really want you to remember that stretching is important. Aerobic, don't forget that your heart is a muscle and you need to use it to build up that endurance and to keep that energy high. But it hurts. Well, as I've mentioned previously, you don't have to do it all at once. Break up the activity 2, 3, 4 times a day. It all works to help, okay? And you can apply ice or heat to relieve your symptoms prior to surgery. Now, pain is okay. Whoa, that's a pretty big statement. So pain is something that our brain feels and our brain right away reacts to. And we have a protective mechanism in our brain that says, whoa, pump the brakes, stop what we're doing. We don't want to cause damage. But in fact, pain is not necessarily an indicator of damage. And there's so much fear associated with movement, with osteoarthritis, fear of doing more damage, fear of making it progress faster or need a joint replacement. But you know, pain is actually okay. As long as you follow these two simple rules, it will really help guide you on how to not be fearful of pain. So rule number 1, pain when exercising is okay as long as the pain is at an acceptable level. So if you look at the scale of 0 to 10, 2 is, or 0 is no pain, 10 is the most pain you can imagine, and 4 is a moderate pain. So if you're at 2 at rest, you always have a mild ache. Okay, but when you go to exercise, it goes up to a 4 or a 5. That's okay. You're like, that's okay. It's acceptable. I can handle this. If when you're exercising, it goes up to like an 8 or a 9, then you say, whoa, 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 that's not okay. That's not acceptable. That's too much. So if it is too much when you exercise, then you need to think about reducing the activity, modifying the activity, or changing the activity. But remember, your pain going up 2 to 3 numerical values with exercise is okay. It's not causing damage. Remember, we need that motion as lotion. Remember, we need those muscles getting stronger to absorb, or those muscles getting stretched and lengthening to help with alignment. But there's a second part to this rule. Rule number 2, increased pain from exercise has to go back to normal or pre-exercise baseline within 24 hours. So if your pain goes from a 2 to a 5 during exercise, and you say, that's okay, it's a moderate pain, and it goes back down to a 2 by the next day, usually within 2 hours you can kind of tell, but by the next day, that's fine. If the next day it's still up at a 4 or 5, then you might say, oh, maybe I did too much, or maybe I need to modify it or change my activity, okay? And to minimize joint stress, what are the types of activities that you can choose? You can choose water. Water is your friend because it takes away those effects of gravity. You can do things like ride an exercise bike or use walking aids, which we're going to go over in this workshop. Avoid things that are high impact, like Stairmaster, jogging, jumping, squatting, all those really impact activities that is going to increase the load. So now let's go over some exercises. I invite you to pause this video and do these exercises, or listen to the instruction and try to do them along with me. Because the more you engage in this workshop, the more you're going to get out of it. So the first one is bridging. This is really working on those glutes. Now remember, we mentioned those of you with hip OA and even those of you with knee OA, you end up with that trunk coming forward a little bit and tightness in the front of the hip and usually weakness in the back. So those are those bum muscles. So you can lay on your floor, you can lay on your bed, go anywhere you want. Bend your knees, put your feet flat on the ground, and your hands can be on the ground for balance, or the couch or the bed. They don't need to be on your chest. Push through the heels, squeeze the bum, and lift up. Make sure that you're not holding your breath. Hold it up for a count of 1, 2, and then lower back down. So once again, push with your heels, squeeze your bum, and lift up. Hold, and you're going to feel a stretch to the front usually when you're holding, and slowly lower. Now, if this exercise bothers your low back, bring your heels a little bit closer in towards your bum, then lift up. If this exercise bothers the front of your thighs, and particularly closer to your knees, then walk your feet a little bit further out before you lift up. The next one is a nice knee extension. Now post-op, you're going to do it this way in bed with a roll underneath your knee and lifting up. But I really like to do this one pre-op in sitting. So what you do is you sit nice and tall, and then you extend that lower leg to be fully straight. The key here is to get a full range of motion, because that inside quad muscle, that VMO muscle, works the last 10 degrees in particular of knee extension, or straightening the knee. So we need to do that full range to really emphasize that muscle we want. Now, if you're sitting right now in your chair, because we want that inside quad muscle the most, we're going to ask that you squeeze your hands in between your knees. So squeeze your knees together against your hands or against a pillow. So you're activating those groin muscles. Then as you're squeezing, lift up your lower leg all the way into that straight position and down. Because by doing the squeeze first, you're really going to be biasing that VMO to activate. So don't add weight unless you can go through the full range. Chair push-up. This is pretty self-explanatory to get a little bit of arm strength. Use your legs and help as you need. Core stability. So if you've been sitting listening to this in a slouched position, what I'd like you to do to start with core is just sit up nice and tall. Think that someone baked some yummy fresh bread or chocolate chip cookies or whatever it is you like to eat, and think that you're lifting to smell that lovely smell in the air, going and breathing it in. So as you do that, you're doing what's called a sternal lift. So lifting your chest, you're lengthening your spine and thinking about lifting your head towards the ceiling to be a nice, aligned, upright posture. So you can think about having this active sitting in ideal posture sometimes when you're watching TV or you're at the office or you're at the dinner table. So if you catch yourself slouching, take a moment and try to do core active sitting for 10 seconds or 30 seconds, and then you can go back into that relaxed position. But do little bits of this active sitting. It really will help your trunk stability. Sit to stand. So think about how many times during the day you stand up and sit down. Now, we all do it, but we're not necessarily all doing it properly. So let's learn how to stand up. So what we want you to do is sit tall in your chair and first start by just thinking that you have a hinge at your hips and you're bending your trunk forward to bring your nose over your toes, but keeping that chest up, not looking at the ground, so looking ahead and then coming back up. So all that's moving is our trunk, like we have an iron rod in our back, so we're not curling it, but we're hinging forward and back. Now what I'd like you to do is hinge forward, then push with your heels, squeeze your bum, and stand up. Now, and then once you're standing, to sit back down, hinge, so that when you're standing, you hinge sticking your bum out, then you slowly lower. Use armrests to help yourself stand up and sit down so that you can do it symmetrically, so you're not really biasing one leg over the other. Now, if you're somebody who, when you stand, your knees cave in, you can do what this picture is showing and have a TheraBand or an elastic band around your thighs. What this elastic band is going to do is have a bit of tension, so you have to kind of have some tension pushing outward, or else the band wants your knees to cave in. By having this tension outward, it's going to keep your muscles active and your knees in optimal alignment as able. If you're someone whose knees fall out when you sit to stand, you can stick a pillow or a ball or something in between your legs and squeeze it so that you're keeping that awareness of where your knees are. Keep that squeeze on the pillow or the ball or something in between your knees while you hip hinge, push through the heels, squeeze that bum, and stand up. Now, if this made no sense to you with the ball and the band, don't freak out. What we want you to do is just work on your sit to stand, trying to keep your knees in optimal alignment and using an armrest as needed to help yourself be symmetrical. If the ball and the band did make sense to you, but you can't figure out if your knees cave in or cave out, that's okay. Do both because they're both beneficial. Now, toe heel ups or toe raises. Stand nice and tall at your counter, squeeze your bum cheeks and raise yourself up on your toes, lifting those heels because our glutes need to be connected with that push off for walking. It's also really good to stand up and practice lifting each toes. Now this picture shows doing it both together. I don't like that. It's not ideal. It's better to stand up tall and lift one foot up at a time so that you don't have any compensatory strategies happening in your hip. Last but not least is our weight shift side to side. So it's really important that we work on our weight shift and work on getting our glutes, so our bum muscles, to contract when we go from side to side. The reason being is because we don't walk in the bunny hop. We walk one leg after the other. So what I invite you to do is stand up if you're not already standing and put your weight on your right leg as much as you can. With that right weight being on your right leg, gently squeeze that right buttock a little bit. Then shift your weight over to your left leg. When the weight's on that left leg, squeeze the left bum. So shift your weight side to side, keeping level shoulders. We're not tipping. So both feet stay in contact with the ground the whole time, but shift your weight side to side. And it doesn't have to be 100% weight on each leg, whatever's comfortable, but focusing on when the weight goes through that leg, you contract the bum on that leg. And then don't forget about your heart, right? Cardiovascular fitness, aerobic fitness, walking, biking, swimming, something to get your heart rate up, okay? You can think about going in water or using walking aids to help reduce joint stress. So there really is a place for mobility aids when it comes to the pre-op pathway. And this is because we really want you to have the most ideal walking pattern possible now. And now, why is that? Well, I want you to think about what you did when you first woke up this morning. So, what was the first thing you did when you had to get out of bed? Well, for most people, they had to go to the bathroom. But did you think about how you walked to the bathroom? Were you thinking, okay, right foot, left foot, right foot, left foot? Were you thinking, okay, heel strike, go down, bend my knee, lift my hip? No, you were getting up and walking to the bathroom thinking, I got to use the bathroom. That's because walking is an automatic process in our brain. It's a fast track, and it's a fast track so that we can multitask. So if you're walking with a limp now, and you might not think you're walking with a limp because sometimes it develops very slowly and your brain has normalized it. So I invite all of you to do a challenge. And what this challenge is ask somebody to video you walking and look at yourself walking. Are you dropping one hip? Is one leg dragging on the ground a bit more instead of lifting? Is your trunk swaying side to side in order to compensate for that leg? So look to see, are you limping? Because if you're going into the surgery limping, how do you think you come out of the surgery? You come out of it limping, because our orthopedic surgeons are amazing, but they're not doing brain surgery. Geez, I hope not, right? So that means that your brain, that pathway is the same. So we want you to use walking aids to reduce your limp and have the most symmetrical gait pattern possible pre-op so that you have the smoothest journey possible post-op. Now, one thing I didn't mention before is about the surgeons are working on the joint and fixing the joint, but what about the motion in that joint? So this is especially for the knee. If you go into the knee joint, the knee surgery, and your knee is only able to bend 80 degrees, how do you think you come out of that surgery? You come out with it only being able to bend 80 degrees or less. But you might say, but the joint's fixed. Why can't I walk or bend my knee? That's because it's the muscles and the connective tissue that are restricting your bend. So we do this session to prepare you for the smoothest journey after. So for those going in for knees, yes, we want you to really push and work on your range of motion, the bending and the straightening of that knee so that you have the smoothest journey after. And for those of you limping, yes, we want you to explore the area of mobility aids in order to have the most optimal walking. So let's get back into this mobility aid topic. So first of all, you could use a cane. So if you have right knee or right hip osteoarthritis, you would use the cane in your left hand. I know a lot of people think it's the same side, but it's actually the opposite side, because then when the cane moves forward with the left hand and the right leg moves forward, your base of support is larger and it's easier to have stability through your pelvis and your body. So your cane would be measured from the floor to the wrist bone. That's how high it should be. So one thing you can use for some stability and balance is a cane. Another thing you can use is something called activator walking poles. These are walking poles that are meant to help you have ideal posture, walking patterning, and reduce that limp. So it's all about activation. So what is different from these walking poles versus maybe walking poles you already have at home? Well, it all comes down to the handle. So if you look at the picture on the right, there actually is a ledge on the handle that the hand sits on. The hand sits on this handle and you push down into it like you're doing an elbow extension, like a tricep extension. So by standing tall with your elbows at 90 degrees, see that lady in that blue coat, especially her right arm there, her elbows at 90 degrees. When you push down into that pole, it really helps to activate your trunk and activate those posterior postural muscles in your back to be nice and tall. Then when you're walking, you can help to offload that leg a little bit because you are grounding down through the activator pole. So you can do an alternate pattern like the ladies in the picture are doing, or you can do double pulling the one surgical leg or the leg going for surgery if that leg is the most sore, especially going downhill. Now, there are a whole bunch of different videos you can watch on activator poles that are online, but what we have found is that activator poles really help clients pre-op to achieve a more symmetrical, active walking pattern. So if you do want to explore getting these poles, you have 3 options. The first one is to check out your local store. So these are the companies that sell activator poles. So in Vernon, Motion sells activator poles, but we know that there are clients from all over the North Okanagan listening to this. So check out a local vendor in your area. You can also go online at urbanpoling.com. There's also some great videos on urbanpoling.com just explaining the poles and showing all of the benefits, and they're called activator poles. If you are local or able to come into the Vernon area, you can also purchase these poles by going to the Vernon Jubilee Hospital Rehab Outpatient Department, and the clerk will sell you some poles. They don't size the poles for you, but they are there to give you the poles so that you can even look at them. If you're not sure if you want to buy them and you don't have a local vendor, but you want to see them, you could always pop into the rehab department just to see what they look like. So those are your 3 options: the Vernon Hospital, online at Urban Poling, or one of your local vendors. Okay, so we've been talking about activity and the need to stretch and the need to strengthen and the need to do our exercises and walk ideally. So that's, movement and purposeful exercise when we're thinking about our exercises. Now, what about the rest of our day? Are we allowed to be sedentary the rest of our day? Are we allowed to watch Netflix marathons? Now, remember, we just said that we don't want large periods of inactivity because we want the whole motion is lotion, having some movement in that, and movement for lubrication in that joint. So the Canadian Physical Activity Guidelines of 150 minutes of activity, that is for activity, okay? But there's no guideline for how we spend the rest of the time. But the key here is we need to keep moving. We need to move a little bit throughout the day to keep that joint lubricated and to help our strength and well-being. And this brings us to the concept of NEAT. What is NEAT? Well, NEAT is pretty cool. So we all know if we burn more calories than we expend, we're going to gain weight. So how do we truly burn calories? Well, let's take a closer look. One is our basal metabolic rate. That's based on our body size. The next one is the thermic effect of food. That's the energy associated with digestion. Then we have activity thermogenesis. This is broken down into 2 spots. Exercise, that's our purposeful movement. That's where you're going to go to exercise class, or you're going to do your exercises from this session or go for a walk. But what about non-exercise activity thermogenesis, NEAT? NEAT is the energy associated with everyday movement. NEAT is the energy associated if you park at the end of the parking lot and walk to the grocery store versus if you park at the closest stall possible and walk in, right? We can add to our NEAT just by adding little bits of movement throughout the day. So what's really interesting is that there can be 2 people of similar statures and their NEATs can vary by 2,000 calories a day. So those of you who are struggling with weight, who are struggling to lose weight, this could be one of the ways to achieve some success, right? This could be a key thing. So you can be a NEAT conserver. A neat conserver is someone who can sit, watch Netflix all day, really happy just staying sitting. They're at their computer, they don't feel the need to get up and move. Or you can be a neat spender, someone who fidgets while they watch TV, maybe they fold laundry, someone who always likes to kind of get up and just do little bits of movement even. So just because you're a neat conserver doesn't mean you can't become a neat spender. You just have to think to yourself, how can you add more movement to your day? So let's think of some ideas. What do you do during the day? Do you like to go out for coffee? Do you like to go to Tim Hortons or Starbucks or something that you just like to drive through and get a coffee? What about if you parked and got out of your vehicle to walk in to get that coffee? Now you think about it, you're doing a sit to stand, you're doing all the steps associated with walking in, you're actually standing while you wait and then walking back to your vehicle versus staying sitting the entire time. So little things like that. Park at the end of the parking lot. I call that the spot where you get increased neat because you're getting more steps in, but two, your car also won't get dinged because there's less people parking there. If you live in an apartment building and you can walk down the stairs but you can't walk up, well, why don't you take the elevator a couple floors above yours and walk down the stairs to your apartment, right? So any way you can add more movement throughout your day is beneficial. We really want to break up those periods of sedentary behavior. If you love to watch TV, well, every hour or every half an hour even, get up and just do a little loop of your house or walk one hallway up and back, right? Even those little bits like that, it seems like not a lot, but wow, do they add up for health and physical benefits. So this brings us to the topic of weight management. Now we've mentioned 1 extra pound of weight equals 4 to 6 pounds of stress on your joints. Now we don't bring this up to really be like, oh man, there's no point, and really to be negative. We actually want you to spin this information to be positive. So you might say, but I'm 50 pounds overweight, there's no point. No, no, no. What we are saying is, don't think I have to lose 50 pounds to make a difference. No, think to yourself, if I lose 1 pound even, that's 4 to 6 pounds less stress on my joints. If I lose 2 pounds, that's 8 to 12 pounds less stress on my joints. So even you losing a little bit can go a long way. So don't get in that negative headspace when it comes to weight. Really just remember that every little bit of weight loss, if you are overweight, can have huge benefits on decreasing the stress on your joints. So how can we do this? So I'm a physio, not a dietitian, so we'll give you some resources at the end of the section here. First of all, set a goal, right? Have some regular exercise. Think about your long-term changes in eating habits, right? Are you eating at certain times of the day? Are you eating because you're bored? Are you eating because you're sad? Are you eating because you can't do the physical activities you want to do? So think about what's causing you to eat and really thinking about what do you drink? How many calories are you drinking a day? Because sometimes those are hidden calories that we don't think about. If you need some resources to help you with weight management, you can go to dietitians.ca or you can go to HealthLink BC, which is 811, or healthlink.bc.ca for the website. Pain management. So this is a big one. What is chronic pain? Now, if you're listening to this presentation and you're on the pre-op pathway, then you have chronic pain, because chronic pain is pain that's been lasting greater than 3 months. It is the result of an overstimulated nervous system. Your brain can never shut it off. It's always aware of that joint. You know what I'm talking about. If your knee or your hip has been sore for that long, you're always thinking, should I do this? Am I going to pay if I do this? Is this damaging it? Is this helping it? It's called the beast on your back. That nervous system is ramped up. Now, we want to bring your attention to the fact that pain is multifactorial. So earlier in this presentation, we had that scale up of 0 to 10 for a numerical value for pain. Now you're going to be asked what your value is for pain a lot, and nobody can tell you what you're feeling, because the physical effect of the osteoarthritis, the tissue damage, is only one component of pain. If it was only tissue damage that factored into pain, then all of our surgeons would say, everybody get a knee x-ray and we'll choose who to do surgery on. But it doesn't work that way because pain has so many different factors influencing it. And we really do need to acknowledge how important every factor is when it comes to pain. So no one can tell you what you're feeling. That's why we will always ask you, how much pain are you in? Because we want you to know. We want to know how you feel because we can't tell you how you feel, right? Pain is very personal. So what are some factors that influence pain? Well, in the middle there in the yellow is tissue. Yes, the physical damage happening in the joint. But there's also other factors, such as, let's go around from the top left all the way around the tissue. Meaningful activities. Maybe you can no longer do these meaningful activities. So it's making you feel more saddened, or it's making you feel more upset. So it's increasing the perception of pain. Maybe your health, you have other health factors factoring in. Maybe you have movement patterns that you've developed that are not ideal, that you don't realize that you've been using, that are increasing the damage to the area. Maybe you have different ways of coping, right? Maybe by your everyone has different coping mechanisms, and some coping mechanisms work better than others. Your beliefs factor into how you feel pain. And then there comes down to the how you are emotionally and your mental health. So there are a lot of factors. Pain is not just physical. This is just a tip of the iceberg on this slide. So what we want you to know is, we know pain is multifactorial, and we want you to recognize that pain is more than just physical. We need to think about all aspects of our life when we're thinking about pain, and that really you're the only one who can tell us how much pain you're feeling. So this is now, we looked at the physical vicious cycle of pain that was on the right there, where you avoid activity, you get more deconditioned, weakened muscles, less motion is lotion, more pain, right? Because more cartilage breakdown, and that cycle continues. But what about the cycle on the left, the psychological cycle of pain? This is when you have pain and then you feel angry, anxious, fearful. Angry maybe that you can't do what you want to do, those meaningful activities. Anxious or fearful that, well, if I do that, am I causing more damage? Am I making it worse? Things like that. All of those are not happy emotions. This can lead to an impoverished mood and even feelings of depression. And what can this lead to? An increased perception of pain. The nervous system is even more ramped up. So now you're feeling the pain more. You're not necessarily fixating on the pain, but that's a really simplistic way of thinking about it, is the more negative you feel about the pain and aware you are of the pain, the more you're going to feel the pain from a psychological point of view. And this brings us to the pain spiral. When you feel that pain, you can have that loss of muscle strength and flexibility from being inactive or getting into those resting postures. You can have altered sleep because maybe you can't get comfortable, or you're having that aching at night, right? And then you're getting that fatigue associated with that, but also the fatigue associated with that nervous system always being turned on. This can lead to mood changes, things like depression, feelings of sadness, just not feeling your regular self. And it can alter your relationships where you feel less patience, right? You're not, and none of these are happy. So we need to find a way to stop the pain spiral. And one of the key things here is keeping moving, right? Motion is lotion, and keeping that movement throughout your day. So I like the analogy of what's in your cup. So if you think about it, we all have a cup. And if our cup is overflowing, we're not coping, right? So if our cup is overflowing, like the picture on the right, we need to decrease something that's in the cup, because we want to look like that lovely, doesn't that look like a latte or something on the left-hand side there in that orange mug? It looks tasty, right? It looks like a nice fall drink. So what's in your cup? Well, there's joint changes and joint chemicals. That's the physiological tissue damage that's going on. Maybe you have a lack of activity, and that lack of activity is resulting in muscle weakness, so more loading, no motion is lotion, but also just feelings of, I want to move and I'm sad or I'm angry, right? Because you're not getting that activity, that stuff you like to do, that lack of activity. Maybe you love being outside, going for a hike, and right now you're not doing that. So you're also feeling that negative feelings from not doing what you love. Lack of sleep, right? If you're not getting sleep, Maybe you're stressed. Maybe you're stressed or you're worried not only about your joint, but maybe you're worrying about some finances or your kids' activities, or there can be multiple things. This does not all have to be just isolated to your hip or your knee joint, right? Maybe you have a sensitive nervous system where everything is tweaking it right now. So if your cup is overflowing, you need to think about what's influencing my life right now, and where could I make some room in my cup? So maybe you're getting a lack of sleep because you're going to bed so late, or you're having lots of screen time before bed, or maybe you're really having a lot of stress or worry about other aspects of your life that maybe you could take a bit more control over. So just think about what's in your cup, because the physical changes are one part of pain, but pain is so multifactorial. We could spend hours talking about pain. This is just the tip of the iceberg, but we just really want you to recognize that pain is more than the physical. Pain is more than just what you see in your x-ray. Because a lot of people see, you can have someone with an x-ray that's showing bone on bone, and they are functioning just fine in this society. And then you have somebody with an x-ray of mild to moderate arthritis, and they are debilitated with pain. But it's real, right? So the point, what we're trying to say here is there's so many factors influencing pain. So we really need to acknowledge all these factors and try to do what we can to calm the nervous system and address them. So how can we dial down the nervous system? Well, you can do calming strategies such as meditation, distraction, good sleep hygiene, right? Getting that good bedtime routine. We always feel better after a good night of sleep. So what are your coping strategies? If you feel yourself getting ramped up, do you take a moment to check in? Do you push through? What do you do? So take a moment right now and close your eyes. Make sure you're sitting. Close your eyes. And just with your eyes closed, take a big breath in your nose. And then take a big breath out. Nice and slow. Feel your shoulders relaxing. Feel your bum sinking into your chair. Pretend there's like a waterfall of sand cascading from the top of your head, down your ears, down your shoulders, and falling to the ground. And that's like pebbles of stress falling off of you. While you keep your eyes closed and just breathe in and breathe out. The big thing here is just checking in with yourself. So sometimes when your nervous system is ramping up, maybe you've done an activity and your pain is starting to increase and you're starting to kind of worry and get anxious about this, take a moment and just sit down and do some deep breathing and check in with yourself. Because sometimes just stopping to take a moment to check in is vitally important, just to calm that nervous system down, to keep it in check. There's so many things you can do now with YouTube and Google, looking at meditation videos or distraction things, relaxation videos. There's a lot of things you can do now to dial it down that are just free on the internet. Another great way is distraction. So think about if you're going for a walk and you're like, oh man, I know my knee's going to hurt or my hip's going to hurt. What about if you listen to a podcast that you're really interested in? What about if you listen to your favorite music when you're riding the exercise bike, right? Thinking about that too. That's a great way to distract yourself from the pain. Now, medication is also an important part in pain management. Yes, I'm a physio. I'm not a pharmacist, but I really believe that pain medication has a strong place, a huge place on the pre-op pathway for helping you to manage your pain. Because the key here is we need you to exercise. So if you need to take pain medication, we need you to do that, because the last thing we want is for you to not be moving. So what your surgeons want you to know is we have two places where we start. First is the acetaminophen family. That's your Tylenol arthritis. That's your 8-hour slow release pain medication. It has the least amount, almost no side effects. The next one is your NSAIDs, non-steroidal anti-inflammatories. These are your Advil, Motrin, ibuprofen, Aleve. These help with pain, but they also help with some of the inflammation. They do have more side effects than the acetaminophen family, including liver, kidney issues, stomach ulcers, blood viscosity, but they do have a different pain management mechanism. What some people will do is they'll take acetaminophen and then they'll take an NSAID when they're about to do a aggravating activity or before bed. Now, what I want you to think about is, 1, are you taking pain medication? 2, are you doing the amount of physical activity you think you should be doing after listening to this presentation so far? And then 3, are you not taking pain medication and then not doing any movement? Because the key here is, if you're not taking meds and then you can't do any exercise because you're in pain, what we want you to ask yourself is, why aren't you taking any medication? Reason being is because we now know we need to move those joints. We need that motion is lotion. We need that strengthening. We need that alignment. We need to really have optimal range of motion going into surgery, especially for knees. So it's key that we take our pain medication. Sometimes we take our pain meds, we do our exercises, our muscles get stronger, our alignment gets stronger, and we reduce our pain meds. But the key here is, if you're not taking pain medication, but you can't do any activity and you're scared or fearful or don't want to take pain meds, then we ask that you go and talk to your doctor or your pharmacist about this, because pain medication does have a place on the pathway if it helps you to get your activities done for exercise, stretching, and strengthening. Your pharmacist in particular is an amazing resource when it comes to talking about pain medication. And of course, your doctor is an amazing resource also. So what medication is right for me? Well, this is where we really do want you to talk to your doctor or pharmacist, because yes, if you're taking medication for other health issues, you want to make sure that what you're taking doesn't have different drug interactions. Depending on what pain level you're on, is the acetaminophen or the NSAID family enough, or do you need more pain medication than that, right? And then what are the risks and side effects for you in particular? And that's where your doctor, your pharmacist is the best person to answer those questions. When should I take it? Well, you should regularly take it to prevent the pain from building up and getting out of control. You don't want to chase your tail, we call it. So especially post-op. If after your surgery you're prescribed pain medication and you choose to not take it, but then you go in for your rehab and your pain is like an 8 out of 10, it's super high, well, your therapist will not be able to do anything with you because your pain will be too high. So it is very important that you keep your pain under control. So once again, that's where your pharmacist and your doctor are a great resource. If you are going to be doing a triggering activity that you know is a bit triggering, then pre-medicate 1 hour before to help manage your pain. You can also use ice. Ice helps to reduce inflammation, pain, and swelling. It changes the message being sent to your brain, where your brain's feeling the cold instead of the pain. So for applying ice, you do not leave ice on all day. You might say, whoa, that's so amazing, I'm going to keep it on all day. No, 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 my friends. Instead, you apply it for a maximum of 15 minutes. So when you are applying ice, you apply it right to the knee joint or right to the hip joint. You don't put it on your lower leg or your thigh. You put it where the source of the inflammation is, which is that arthritic joint. Make sure that the ice is cool, not cold, and always monitor your skin. Make sure if you think you might fall asleep with the ice that you set a timer, because you do not want to have that ice on longer than about 15 minutes. Those of you going for knee replacements, you can always rent or purchase an ice machine called a cryo cuff or something like that. That really helps to circulate cool fluid around the joint in a nice way. You can usually check medical stores for renting those, or even just look online. The cryo cuff machine is the one for knee replacements. Now, heat. Heat is something you can do pre-op, but not post-op. The reason being is because we don't want to really increase circulation to that area post-op and increase the swelling. But heat can have a big positive spot. Because what does heat do? Well, you put heat right over the muscles to reduce the tension and reduce the compressive forces through the joint. So you're icing the actual joints, but you could heat the thigh or the low back to reduce some of the tensile forces through that joint. So you can apply heat for 20 minutes. Never apply heat if that joint is swollen or throbbing, but really it is meant to be on those tense muscles, and it really could help before you do an activity to loosen it up. Now remember, pain is multifactorial, so therefore you need a multimodal approach for pain management. What does this mean? It means that you have a toolbox. So if Sally lives next to Jim, and for Sally, certain things work, and Jim's like, no problem, I'm going to try those things, but they don't work. So then he says, well, why aren't they working for me? It's because we're all different. You got to pull something out of the toolbox, and then if it doesn't work, you throw it back in and you try something else. You need to try a combination of things like pacing your activities, mobility aids to help improve your gauge or offload that leg, medication, ice, heat, calming strategies or strategies that really decrease or calm down that nervous system. Think about your cup. What is in your cup causing stress or taking pieces of you as you feel in your life? So what is in your cup influencing pain? And so if you can't reduce the physiological effects on the tissue right now, what else could you affect, right, in your cup to address the pain? And remember, we're all different. We all feel pain slightly differently, but also what works for one person won't necessarily work for another. So just keep digging in that toolbox to find the right thing for you. Now we've talked about exercise. We've given 7 specific exercises, plus the need for cardiovascular fitness. We've talked about walking aids for walking. We've talked about how we can use pain medication to reduce pain. Now, what may prevent you from adding activity to your day? What may prevent you from getting those 7 exercises completed? What may prevent you from doing some walking, right? Or increasing your walking if you're already doing a short amount. From achieving that minimum of 22 to 30 minutes of activity a day, right? Of reducing your sedentary behavior. So think about it for a moment. What is your barrier to exercise? Now, we've given this session many, many times in person, and what we found was there was a common thread. What are some of the barriers? Well, everyone says pain. Well, we've just mentioned for pain, 1, you can use medication. 2, you can use common strategies. 3, mobility aids. 4, exercises that reduce joint stress, such as water or exercise bike. 5, pain is actually okay. Remember our pain rule? If your pain goes up, but it goes up to an acceptable amount, as long as it goes back down to whatever your baseline is, and baseline isn't normally 0, as long as it goes back down to baseline, that is okay, right? So usually pain really is that protective mechanism saying stop, 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 stop. But what we're telling you is as long as the pain is acceptable, it's okay. We need to exercise. Another barrier a lot of people say is, I'm lazy, right? I don't want to do it. It takes less energy to watch my Netflix, right? Than it does to get up and move. Well, this is a common barrier for all ages, all disease processes. So what can we do to overcome the barrier of feeling unmotivated or lazy? Well, there are a couple of things you can do. You can get a buddy, right? That accountability partner, whether it's a physical person or a person over the phone, right? Or even over one of your an app. So maybe it's someone and you say, okay, we're each going to walk this far this week, and you chart it on Strava or something, or like some app that records how far you walk. Maybe you phone, maybe it's you and your friend, and at the end of every day you say, do you do your exercises? And that's your accountability partner, right? Maybe you actually have somebody that you go walking with, so a buddy to actually physically do the exercises with. Another way to help with lack of motivation or laziness is to schedule it in so that it's part of your day. So you actually have it scheduled into your day timer. 12:30, so right after lunch, I'm doing my exercises from 12:30 to 12:45. So it's part of your day. So it's not, oh, I'll get it done at some point. It's actually part of your day. Maybe you also think about joining a group class, such as a water class or an exercise class, because then you have someone who's expecting you to be there, and it's a certain time that you need to show up. So those group classes can be so good for keeping you energized and enthused and motivated to attend. So there are a lot of ways we can work at trying to stay motivated, because that definitely is an issue that everybody experiences at some time. Another barrier people brought up is time. I don't have time. There's only so many hours in the day. We're finding that it is a younger and younger population going for joint replacement. So a lot of people are the working age group still, right? So how can we overcome that barrier? Well, if you recall, we mentioned you don't have to do it all at once. You can do little bouts throughout the day. Maybe when you wait for your coffee in the morning to percolate, you do your heel raises. Maybe you're listening to a meeting and your camera's turned off and it's a virtual meeting, and you do your sit to stands while you're listening, right? You just add the movement and the exercises throughout the day so that you can add some movement throughout the day. So it doesn't have to be all at once. Also, when it comes to time though, we want you to remember that you have chosen to be on this joint replacement list to have an elective hip or knee replacement. So what we're saying with that is we want you to choose you. We want you to prioritize yourself. Make yourself a high priority. Think about, I want this surgery to be the best success. I want to optimize. I want to do everything I can to make this surgery the best surgery I could have. So what does that mean? It might mean you need to prioritize yourself higher than you have been. If you haven't had time to exercise, you need to find the time. Maybe your house stays a little bit dirtier. Maybe you eat a little bit more simpler meals or something like that. Or maybe, you have to not do something else to fit it in, but really prioritize yourself, because getting your exercises done and really investing time in yourself during this surgical pathway is time well spent. So when it comes to barriers, another great way to get over barriers about motivation and things like that is just set a goal. So a goal without a plan is just a wish. So we need to make a plan. We need to set a goal. So ideally, goals are SMART goals. What do we mean by that? They are specific, measurable, attainable, relevant, and time-bound. So attainable meaning, well, if you haven't been walking one block, we're not going to make the goal, I'm going to walk 30 minutes in 1 week, right? So you're going to make the goal, maybe if you're just walking one block, maybe you're going to walk one block every day, right? So make sure that, you want to have success. You want to be able to check it off to say, I did this. So it's using these as an example. Instead of just saying, I'm going to exercise more. How do you know you achieve that? How do you know you can check it off? Is walking that one block exercising more? Is doing one set of exercises exercising more? Instead, make it more SMART. Make it more specific. I'm going to walk around the park for 20 minutes, 5 times a week. This month, I'm going to do water exercises for 30 minutes, 3 times a week. So you can make the goals for every week. You can make them for every day. You can make them for whatever you would like. But really think about, if you can set a goal, it will help you to achieve success. So going back to this slide of SMART goals, take a moment and think about an activity goal for you that is specific, measurable, attainable, relevant, and time-bound. So you know when it should be done by, okay? So really take that moment and think about, what is your activity goal so that you're prioritizing you. Tips to succeed with these goals are things like write those goals down, right? Post them on your fridge where you can see them, write them, have them on your phone even where it comes up on your screen. You want to see your goals to keep them forefront in your mind. Share them with your friends and your family. So maybe you're trying to go to aqua exercise classes, so water exercise classes 3 times a week. So maybe you tell your friends or your family, I'm going to the rec center and going to do water exercise. And I'm going Monday, Wednesday, Friday. And then when you talk to them on the phone, they say, did you go? And you're like, yeah, I did, right? So that they're aware and able to empower you and encourage you. Maybe they even want to go with you. And also remember to have a backup plan. So if your goal was to walk outside, right? But like today, I look out my window and it is a snowstorm outside. So instead of saying, I guess I'll just throw in the towel today. No, 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 my friends, you have that backup plan. So what could the backup plan be? Maybe you want to go to water classes and the pool's all of a sudden closed up for no reason one day. What's your backup plan? The backup plan is never throwing in the towel and not doing anything. The backup plan is what's an alternate activity that's also going to give you success and bring you joy. Well, if I can't walk outside, maybe I'll go walk inside at the mall or at a large department store like Walmart or something like that, or at a local arena, right? Maybe if I can't get out of my driveway because there's so much snow or it's too cold and I say, oh geez, I say, well, I'll do an extra set of my exercises today. Or maybe I live in an apartment building and I say, I'm going to walk around the whole building, or I'm going to go to the main floor where I might run into some people and walk around, right? So just remember, always have a backup plan, because you definitely, to succeed, we want to stay focused on our goal. But if something changes and we can't achieve that specific goal of that day, we want to have that backup plan so we're still feeling that success. So mobility and home safety. Well, while you're waiting for your hip or your knee replacement, we absolutely do not want you to have a fall and break anything. So if you are feeling unsteady on your feet, you need to maybe think about having some home safety equipment. So if you're feeling unsteady on your feet when you're walking, then doing something like using a cane or activator poles or a walker, if your balance and mobility is at that point, is really highly recommended. If you are having problems getting in and out of bed, you could use a bed rail. If you're having problems getting on and off your toilet, you could have a raised seat or use toilet rails. If you can't get in and out of your tub safely, you're feeling off balance, having your weight on one leg for so long while you step over, you could install grab bars, or like that picture, it's called a tub clamp, or you could get a shower chair to sit on. So just remember that home safety equipment has a place. You will get forms right before your surgery for the Red Cross. That is for the home safety equipment attached to your surgery. Okay, so that's where they give you the equipment that you need post-op. But if you need equipment now, so now is, not right before your surgery, but if you need it now, Red Cross is not the place to get it. So Red Cross is only for post-op for the people on the surgical pathway, because otherwise they'd have no equipment to loan out, because Red Cross is a 3-month maximum. So where can you get equipment now if you need equipment for your bathtub, your shower, your toilet, your bed, your walking? Is a medical supply store. You can either rent it or purchase it. And if you have extended benefits, you can always check if you have coverage through a medical plan. One thing to note is the activator poles, to our knowledge, are not covered on any extended medical. You can phone your extended medical to double check, but to date, the activator poles, because they are still under the category of walking pole, they're classified as a recreational walking aid, even though we are using them as a medical walking device. So here are some other resources that you can use. Go to these websites. These were also around some handouts and links and on the web. But arthritis.ca, that health link BC of 811, and there's the link below. Exerciseismedicine.org or Physical Activity Line. There's some great websites for you to check out. Other places for information is you can watch these Dr. Mike Evans videos. They are so fantastic. I highly recommend them. It is a doctor who is partnered with a cartoonist, or maybe he is the cartoonist, I don't know. But his videos are so entertaining to watch, but also provide amazing information. So Make Your Day Harder is all about the concept of NEAT, right? Increasing your NEAT. 23.5 hours, and then hip and knee replacement. Oasis is the Vancouver Coastal Health website. They also have some great links you can look at. You can go to all videos under the heading of Manage Your OA. So, there's videos on this, on Interior Health has videos, but the Vancouver Coastal Health also has an extensive website. It's good to just look out there and see what's out there and gather all the information you can. I can't say I'm entirely pleased with my hip replacement. Well, I don't think any of you have signed up for a zebra hip, but the point of this is we want you to be pleased. So hip and knee replacement surgery has an extremely high success rate, but the key part of this whole presentation is we need you to be an active participant. So the more you put into this, the more you work on your motion is lotion and work on helping your walking to be as symmetrical as possible, the better and smoother your joint replacement is going to go. So you are the captain of the team, and your whole healthcare team is surrounding you to give you the resources and to help you along the way. But remember, you're the captain. So we really highly encourage you to get in there and be that active participant, because we want you to be pleased. But if you do have any questions or concerns, we are here if you need to contact us. NOKLivingWell@interiorhealth.ca. So please feel free to email us if you have any questions regarding this presentation, and we will get back to you at our earliest convenience. So NOKLivingWell@interiorhealth.ca. We would really like to thank you for listening to this presentation, and we really do wish you all the best on your surgical journey. So remember, motion is lotion.